I'd like to thank our survey partner, YouGov, and also big thank you to our headline sponsor, Mercer. This report is the second of a 3-year cycle, and the report findings and recommendations are based on information we gathered with YouGov. We've actually had an incredible response to this webinar today, and also it got so much coverage in the press last week, even though the PM's speech took headline coverage as well. I'm Mark Radford. I'm a corporate advisor here at Business in the Community, and I'm with Louise Aston, our Wellbeing Director. Today is World Mental Health Day, and this year's theme is Workplace Wellbeing. So a really timely release of our Mental Health at Work report in 2017 was released last week. Business in the Community is the Prince's Responsible Business Network. Our members work together to tackle a wide range of issues that are essential to creating a fairer and more sustainable future. The Wellbeing campaign in particular has an aim, and it's to create a happier, healthier and engaged workforce that drives productivity, benefiting employers, employees, customers and resilient communities. And we aim to elevate mental health to a strategic boardroom level, to take a whole person, whole system approach to wellbeing, and position mental health on a parity with physical health. Just like to spend a little bit of time dispelling a few of the myths around mental health. So a myth is that people living with mental health issues cannot work. Well, by promoting a culture where people are comfortable talking about mental health, businesses can make it easier for employees and managers to discuss factors that might affect someone's ability to carry out their usual role, and make reasonable adjustments to help them remain productive without compromising their health or well-being. Another myth is that people pull the mental health card out to avoid disciplinary action when their performance isn't up to scratch. Well, the performance of many employees experiencing a mental health issue is often in decline and can sometimes unfairly result in disciplinary action. It's really important that employees are able to disclose the mental health issue so their employer can support them and make reasonable adjustments if necessary. If their performance does decline because of their condition, an empathetic employer will take this into consideration. Another myth is that only some people are affected by common mental health issues and they will not fully recover their performance after a period of mental illness. 1 in 6 people of working age have a mental health condition given this year. However, we see it as 6 in 6. The mental health of every person is on a continuum and varies monthly, weekly, daily, or even hourly, depending on individuals, as well as many factors in the day-to-day life. While 1 in 6 people may be diagnosable with a mental health condition, everyone experiences fluctuating levels. I don't know if you saw in the news recently, it was in the Sunday Times this week, this case study about Antonio Oreo Osorio. It's a really excellent case study demonstrating that with the right support, people with mental health issues shouldn't be written off and can get better and perform well, aligned to all recommendations in our Mental Health at Work report. Antonio is Chief Executive of Lloyds Banking Group, and he fixed Lloyds Banking Group's financial crisis. He's the only chief executive of the bailed out banks to have paid back every penny to the government in 6 years since it was encouraged to take on the task by George Osborne, the Chancellor at the time. Within months of starting his job at Lloyds, he was in the Priory Clinic for 9 days with sleeping pills, resting 16 hours a day in order to prevent his body tipping into total nervous breakdown. Stressed and unable to switch off, consumed by the magnitude of the task ahead of him, his insomnia had reached a crisis point and he'd not slept for 5 days. As insomnia and anxiety set in, he lost more and more of himself. His speech slowed, his concentration in meetings was not sharp, his quick grasps of figures fell away. He felt a spectator at a dinner with my own family. Antonio was always worried about the promise he had to make to pay back all of the money within 100 days of being in the post, and he just couldn't sleep. He felt detached from his life. His anxiety levels were really high, and it took 6 to 9 months to come off the sleeping pills, eventually through a period of recovery. Antonio had to learn about himself, and not just how to sleep again, but also how to manage his stress. He had to relearn to view himself, become a better person, more patient, more understanding, and more considerate. But now he's got a clear mission to add his voice to those of the increasing number of influential people taking their own mental health difficulties. This is a great example of someone that had a mental health issue, and with the right support, he got over it. Okay, at this stage, I'd just like to ask if anyone's got any questions before we move on to the next session. If we just give it a minute, if you've got any, please type them in, and we'll come back to you very quickly. Thanks for the questions. We've got one here. How can the well-being of line managers be supported in order for them to have the capability to support others, Louise?
This is all really about really strong leadership. So obviously leadership needs to come from the top. Is mental well-being should be positioned as a boardroom issue, but in terms of actually translating and being embedded into organizational culture, is the culture should be supporting the physical, mental and social well-being of everybody in that organization. So that's about employees being able to make informed, healthy choices that supports their health and well-being at work.
Okay, we've got another question. How can you make your employees feel more comfortable to discuss their mental health issues with their line manager?
I think it's really important that employers should really consider signing up to the Time to Change Employers Pledge, because it really gives a green light for employers to talk, is in terms of a senior sponsor actually making that commitment to break the culture of silence. And I think this is about taking small steps to normalise mental health. So as a line manager myself, I always ask my team at the beginning of every meeting how their well-being is, and I really mean it, and I really listen. So it just becomes totally normal. So I think leading by example as well is very, very powerful.
Okay, thank you. I think that's the questions we've had so far. We'll perhaps have a chance at the end for a few more questions as well. But Louise, would you like to take us through the report now?
Yeah. So last Wednesday, we launched our second Mental Health at Work report. And as Mark said, is in terms of the amount of interest we've had in findings, because obviously they are benchmarks against last year's findings. So really the objective when we embarked on this massive project is what were we trying to do? Is basically this is like a kind of annual barometer, if you like, in terms of measuring the state of the nation employee mental health at work. So we got our 2016 baseline, and through the data that YouGov captured, it was actually seeing where line managers actually needed support and identifying how we could support them through recommendations. A lot of this isn't just about the well-being of line managers themselves, it's also about their capability to support others. It's about showcasing good practice so everybody can learn from each other. And I'll say a bit more about collective action, but this is really about a massive collective action between business, national organisations and individuals. We all have a responsibility to move the dial, and was also to identify 3 consistent calls to action to keep the kind of drumbeat going in a consistent way, and key recommendations. So in terms of leadership for this initiative came from Business in the Community's Wellbeing Leadership Team, which is comprised of 16 business leaders from a whole range of sectors. Our headline sponsor was Mercer, who's one of our leadership team members, and we worked with partners, Mental Health at Work, Mental Health First Aid England, Mind, the Institute of Leadership and Management and the Work Foundation, in terms of actually kind of pooling resource and actually being totally joined up in the messaging. So obviously all of those organisations are doing great stuff to promote mental health, but in different but complementary ways to business in the community. So the headline findings for 2017. Well, I'm really pleased to say that we've seen some really great incremental positive changes since 2016, and I think this is a real testament that businesses are really waking up to the importance of managing mental health. So we know that 53% of employers are now more comfortable talking about mental health in the workplace compared to 50%, but that 6% is a significant shift. More managers reported having made referrals for counselling or occupational health in this year's survey, up from 30% in 2016 to 40%. That's a huge leap in a year. And managers were more positive about the support they've received from senior management when trying to support an employee with mental health issues. So 31% now state that senior management has been very supportive compared to only 23% in 2016. So a few more positive shifts since 2016. So more of those experiencing a mental health issue reported positive responses in this year's survey. So that's shot up from 30% in 2016 to 34% this year. And 3/4 of managers agreed that the well-being of employees is their responsibility in 2016, and that's shot up to a whopping great 84% in this year's survey. And again, really, really delighted to see that more managers feel confident that they could spot the signs of a mental health issue in the people that they manage. So that's really excellent news. So in terms of just talking you through the kind of a sort of overview of the whole report, the report is on our website, and I will give you the link at the end of this, but it's easy to find. So this section is we all have mental health, and the majority of employees are affected by the symptoms of poor mental health. So that's with poor mental health, that's experienced by 3 out of every 5, and that's due down to work. But what we think is, rather than, we talk about 1 in 4 of us will experience a common mental health issue in any given year, is actually, let's reframe this and talk about a 4 in 4 kind of inclusive issue, is we all have mental health in the same way as we all have physical health. But in terms of 1 in 3, 31% of employees have been formally diagnosed with a mental health issue. That obviously is higher than the 1 in 4. So a majority of employees are affected by the symptoms of poor mental health. We talked about almost a third have actually been formally diagnosed with a mental health issue, which is a slight increase from 29% in 2016. And the most common diagnosis was depression or general anxiety, both common mental health issues. So I'm now going to talk about the disconnect of the aspiration and the reality, in terms of the aspiration of senior business leaders and the reality for the rest of the organization. And this disconnect runs throughout the survey, as it did in 2016. So 61% of board members feel their organization supports employees' mental health at work. We've heard a lot in the news about fantastic rhetoric that senior leaders are talking about mental health, but this simply isn't translating into kind of impactful sort of actions. So the perception from the rest of the organization that 40% actually, there's a big disconnect there. pervasive culture of silence. More employees now feel comfortable talking about mental health. So that's great that 53% of employers feel comfortable talking about mental health at work. There's a really nice quote here. I feel I could talk in confidence and be taken seriously, not judged by a mental health condition. You know, that's real progress. But 51% of employers would still not be comfortable talking to their line manager about a mental health issue at work. So we've still got a long way to go in terms of that disclosure, because without telling their line manager, that doesn't actually give line managers a chance to necessarily give that person the support they need. I think this is really frames where kind of mental health is in terms of other difficult subjects to talk about. It's right close to the bottom, you know, after religion or belief or race. So we've still got a long way to go in terms of raising that bar, in terms of making mental health business as normal and an easy thing to discuss.
Right, okay. Thanks for that, Louise. We'll go back to the report in a couple of minutes or so, but just want to ask a few questions really to get you thinking through a quiz. So the first one, where do you think people are most likely to seek support when dealing with a mental health issue? Just have a think about that one. Well, employees are still preferring to seek help externally rather than go to the line manager. 60% of the people who had a mental health issue in 2017, where work was a contributing factor, but only 13 disclosed it to the line manager. 62% would rather go to their GP, compared with 15 seeking help from the line manager. Next one is around which age group do you think is most likely to be diagnosed with a mental health issue? Well, in fact, younger employees are more likely to have a mental health issue, with 39% of those aged between 18 to 29 having been formally diagnosed with mental health condition, compared to 29% of people in their 50s. This may be because of growing awareness about mental health among that age group, but they're also less likely to disclose concerns. Less than half, about 44%, feel comfortable talking about mental health issues at work, compared to 47% in their 40s to 50s. Are men or women more likely to experience mental health? Well, women are more likely to report experiencing mental health issues as a result of work, with 64% reporting issues compared to 56% of men. 39% of men sought no support from anyone during the most recent occurrence, compared to 28% of women. While women in 2017 find it easier to talk about mental health at work, only 50% of men feel comfortable discussing the same sorts of issues. And do you think that BAME employees are more likely or less likely to discuss mental health at work? Well, Black, Asian and minority ethnic employees are less likely to feel comfortable talking about mental health at work. They're just as likely to experience mental health issues as other employees, but they have been formally diagnosed with mental health conditions, but only 43% of BAME employees feel comfortable discussing mental health, compared with over half, about 54% of white employees. Louise?
Yeah, so we just thought we'd break up the content of the report a little bit and get you thinking. So going back to the overall findings of the report, again, some really good news here is in terms of the role of line managers. The great news is that significantly more managers accept that employee well-being is their responsibility. And as I said earlier, that has risen from 76% from last year to 84% for this year. However, in terms of all this kind of regarding well-being as their responsibility, 24%, that's less than the quarter, but if you turn it on its head, that 75% of line managers have received no training, although we know also from the report that 49% would really welcome basic mental health training. So this is a massive opportunity for employers to actually push at an open door, and in terms of actually introducing line manager training, whether that's basic mental health literacy, whether it's mental health first aid, or having something that's actually tailored to the needs of your particular organisation. The other, coupled with that, is 35% of managers report not having any workplace facilities or services that could help mental health and well-being. So again, employers really need to take this on board and actually think about how they could actually provide some kind of facility or services that could actually help mental health and well-being. And the other good news is when employees do disclose a mental health issue, positive actions are taken in the majority of cases. So that's 72%. So that, that is really positive. However, and this is the real shocker, is that we know basically more people are actually receiving help, but a shocking 15% of employees who disclose a mental health issue subsequently face disciplinary action, demotion, or dismissal, which is actually increased to twice the amount identified in the 2016 survey. So if you scale this up in terms of the general working population, this could mean that as many as 1.2 million people are negatively affected for disclosing mental health issues. Now, this is a real injustice because with the right support and perhaps reasonable adjustments like workload, flexible working, or working from home, people with mental health issues or long and enduring conditions can get better and can work effectively. The reason that we included the news story of Antonio Osorio from Lloyd's is that is a fantastic example of someone who did disclose to his business that he was suffering from fatigue due to anxiety. They did provide him with support at the Priory. They did actually have faith that he would get better, even though shareholder value dropped by 5%, and he did get better and basically did the most extraordinary job in turning around Lloyd's. So I think we've reached the real tipping point with mental health. There's a huge amount of understanding and prominence in terms of the debate that's going on, particularly with Royals talking about mental health, along with business-led movements like BITC and City Mental Health Alliance. But in some cases, this awareness raising has been counterproductive, where you've got employees disclosing in less empathetic or educated organisations. We know that, like physical health, people with mental health issues can and do get better, and this is about actually making those reasonable adjustments on an equal footing as physical health. And I do think that there's a real gap here in terms of a consensus of guidance of what good looks like. But in terms of back to the disconnect with how senior bosses think they're doing and the reality, there's clearly a long way to go to actually matching those two things up. And one of the kind of just quite an easy thing is, in terms of 28% of employees with mental health issues said support with their workload would have been a useful response. So basically is in terms of thinking about what reasonable adjustments can be made, that is something I would urge you to think about. And we also know that work is often part of the solution. It's easy to sign people off sick, but in a lot of cases it's actually making alterations in terms of job design that can be very helpful.
Okay, thank you, Louise. There's an awful lot of information that you've been given there in a really short period of time. We've got a few more questions now, just to give you a chance to digest what you've heard. And if you've got any questions, please send them through to us. So we'll give you a minute or two just to put any questions through. We've had a question through, Louise, and it's saying, how can we close that disconnect between a line manager acceptance and employee well-being, and how can they actually define that it's their responsibility, and how can we help their capability to do that as well?
Yeah, so I think the stat that really stands out for me is we know that line managers are kind of willing, in terms of 84%, see well-being as part of their responsibility, but we know that 75% didn't actually receive any training at all.
Yeah.
So there's a huge opportunity there, and I do think, line managers can't be expected to be counsellors. So in terms of actually making line managers feel better equipped in terms of what sources of help and support are available within your organisation, or at least put something together where you don't have kind of in-house specialisms, where anybody can go and access support.
Okay, thank you. Another question about workplaces. We know that many workplaces don't have facilities or services to support employee well-being. How can businesses create these facilities in a really cost-effective way?
I think a lot of this is actually about breaking stigma. So in terms of actually piggybacking onto a lot of national campaigns, like, Heads Together, the one the Royals are involved in, Time to Change, which has got Time to Talk Day, today, like World Mental Health Day. There's loads of resources, campaign resources with mental health at work being the theme. There are lots of other freely available resources like, helplines to the Citizens Advice Bureau, and a lot of employers, even small employers, often have an EAP, which can be very helpful indeed.
Okay, thank you. Right, we'll move on to the final part of the report then, Louise.
Yeah, so within the report there are spotlights, which I'm literally just going to gloss over, around age, gender, race, common mental health issues, and long and enduring mental health issues, but just some highlights. There are differences that remain entrenched between men and women in relation to mental health, and we know that female managers are more confident in recognizing the symptoms of poor mental health, but we also know that basically over 2/3 of women would feel confident responding to depression, anxiety and panic attacks, compared to fewer than 1 in 3 of men. And we know also that 39% of men sought no support from anyone during the most recent occurrence, compared to 28% of women. So a lot more women were good at actually seeking that help. So women generally find it easier to talk about mental health, whereas men don't feel so comfortable and are much worse at accessing support. We're also very concerned about young people in the workplace. Basically younger, and in particular younger managers, overwhelmingly agree that what they do affects the well-being of employers, yet they're less comfortable than older managers in terms of recognizing the symptoms of mental health issues and being able to talk to anyone who might be experiencing them. And 2/3 of managers in their 30s, only 2/3 of managers in their 30s have the confidence to talk to someone they manage about mental health, and that's compared to more than 3/4 of line managers who are older or in their 50s. And then we've already, in the quiz earlier, we've flagged that actually BAME managers are far less confident about talking about mental health issues than white employees, but 26% of white managers believe there are no barriers to supporting staff wellbeing, compared to only 13% of BAME managers. So that's a huge difference. So the key recommendations from the report, obviously there's a lot more detail than here, is it really is about taking ownership of mental health in your workplace. There's a lot of really good practice out there. In the report, we've got a stunning 35 case studies, and there's a lot of employers who are doing really great stuff. But we also know there's a lot of employers who simply aren't engaged with this agenda at all. It's about ending the disconnect. So primarily that is with the senior bosses in terms of being out of touch with the rest of the organization, and basically the interventions aren't working or aren't as impactful as they might hope for. It's about empowering those line managers who are willing but not always able. It's about confronting the culture of silence. There's still kind of fear of disclosure. The importance of always responding to employers with appropriate and effective support. So it's making sure you've got that in place. So this is really our focus is very much around prevention. So it's about prevention, early intervention, and then if somebody does go off sick with a mental health issue, it's about that active rehabilitation to get them back into work by making those reasonable adjustments or job design as soon as possible, and reinforce mental health support for groups who feel excluded. So that could be BAME, it could be LGBT, but again, with all of this, no one size fits all, and you've basically, there's no silver bullet. So our 3 calls to action are very simple. Is talk, you can't manage what you can't talk about. So break the culture of silence that surrounds mental health by taking the time to change employers' pledge. No empty pledge, there's actually an action plan, and obviously the very senior signatory that goes in the public domain. Is train, so that's about investing in basic mental health literacy for all employers and line manager training in mental health first aid. So again, it's positioning mental health on a parity with physical health. And take action, which is, if you go to our website and check out our mental health toolkit for employers, is that toolkit is absolutely fantastic in terms of wherever you are on your journey, it will support you, and everything in that toolkit is freely available in terms of services and resources. So if you'd like to read the full report, the exact summary and the full report are here at Wellbeing BITC.org UK. If you'd like to tweet about anything you've heard, is here the kind of social media tags. We're looking for case studies for our next year's report, so if you're interested, please contact me. The other thing I forgot to mention is that also within the report there's 5 sector spotlights on financial services, professional services, retail and utilities, and fast-moving consumer goods. So please look at the report. And just to reinforce that this webinar will be on our website in the next few days.
Okay, thank you, Louise. There's an awful lot on there. I know we've covered a lot today in quite a short period of time, but just a couple of minutes if people have got any more questions. We'll just wait for them to come through. We've had one through now that just says that more managers are accepting that well-being is part of that more managers are accepting that well-being of their employees is their responsibility. How can we keep this momentum going, Louise?
Yeah, I think this is really down to the senior bosses in terms of ending that disconnect. Is basically, you know, as I've said several times during this webinar, is those line managers are willing but not able, and in terms of the senior management actually making that investment in the training of their line managers is really, really important. And I think there's also basically this huge injustice about people who are getting demoted or even dismissed or disciplined, is that actually we need to think about appropriate line management training for people who are actually experiencing mental health conditions, so they're not actually written off with disciplinary or dismissed. That's you know, you can't blame the line managers for that, because often they just haven't got the right guidance.
Okay, thank you. I think the questions have dried up, probably thinking about all the information that we've given you. Once again, thank you so much for attending this webinar. I hope you found it really useful. It's a really important subject that hopefully we've given justice to. And please don't forget that a recording of this webinar is available on the BITC website within the next few days. Thank you for your time.